Hey guys, Dr. Nate here at Thrive Dental Orthodontics, and let me walk you through the steps I look for in order to determine if you or your child needs braces. So step number one, we want to look for age. Now, just because your kid may have some symptoms or signs that they need braces doesn't necessarily mean they can get them yet. So what I typically look for the front four teeth, front four adult teeth, and the first molars. And why do I do that? Because I need those teeth as anchors. Specifically, I need the first molars, or we sometimes call those the 6-year molars, to be in, because I use those for a ton of things. I use those for expanders, I use that to advance teeth, I use it for a ton of different things. So the American Association of Orthodontics recommends you come in for a visit at the age of roughly 7. And I think that's a great age, because at that time you have the first molars most of the time, and then you have some front teeth. And what I am looking for in you, or what I'm looking for in an adult or a kid or anybody, is 9 different things that I'm gonna walk you through right now. Number 1, spacing. If there's excessive spacing, that might be an issue. A lot of times we wanna close that, not just for aesthetics, so that other teeth can come in as well. So number 1 is spacing. Number 2, crowding. If it's too crowded, sometimes teeth can't come in, or aesthetically it just doesn't look good. And that is probably the number 1 thing people want corrected, is probably crowding. Number 3, open bite. So if people bite down, instead of biting like that, but their front teeth don't come together, we call that an open bite, and that can be caused by a bunch of different things. If you're younger, sometimes that's caused by finger or thumb sucking. If you're older, it could be because your jaw is growing in a divergent manner. So there's a bunch of different ways to get it. So number 4 is deep bite. So people often tell me, hey, I have an overbite, I don't want to overbite. But yes, you actually do want to overbite. You just don't want it to be too much. When it's too big, we call that a deep bite. It can actually damage your front teeth if it's too big. Anterior or front crossbite, that's number 5. If the top and bottom teeth are in the opposite relation, so instead of your top teeth being in front of the bottom teeth, your top teeth are actually behind the front teeth. Like that, we call that an anterior crossbite. And that is something that can definitely damage those teeth, especially the front teeth, because they get pushed outwards and there's no bone there. So sometimes it gets pushed so far out that those lower teeth actually get lost. The next thing I'm looking for is a posterior or back crossbite. So same thing as the front, you want your top teeth to overlap the bottom teeth. If it's the opposite, if your lower teeth are too far on the outside of the top teeth, and that is called a crossbite, and our teeth are not meant to bite like that. If you're young enough, if you're say below the age of say 16, you can get something called an expander, easy peasy to correct. To expand those top teeth, boom, everything looks nice and pretty. If you're an adult, you cannot really use an expander, so sometimes you have to get jaw surgeries or use these mini screws or all different sorts of things to try to expand those top teeth as much as possible. The 7th thing is an underbite, when it's totally, completely an underbite. So not just a few teeth, when we call that an anterior crossbite, but an underbite is when all the front teeth are below, or sorry, on the outside of the top teeth. And there's a couple ways to fix that. One is if you're young enough, if you're maybe 8 years old or so, we use something called the reverse pull headgear, and that allows those top teeth to come forward. If you're an adult, that may not work, so you're probably gonna have to have a jaw surgery of some sort if it's a skeleton issue. But that is a big one we look for. An anterior crossbite is a little different than a full-on underbite. Underbite is when all those teeth are on the outside of the top teeth. The 8th thing I look for is overjet, and that's if those top teeth are sticking out way too far in front of the bottom teeth. We call that an overjet. That is different than an overbite. Overbite is a vertical thing, so if the top teeth really overlap the front teeth, we call that an overbite, like a deep bite. Overjet is when they stick out too much. So that's when a lot of people come in and it feels like their lower jaw is too far back, which it may be, or it could be their top teeth are too far forward. So excessive overjet is what we're looking for as well. Ectopic eruption, or like excessive crowding, is probably the last thing I'm looking for as well. And that happens when a tooth is actually growing, but it doesn't even look like it's in the right area at all. So it could be a canine tooth, one of those sharp teeth, growing out here, over here, over here, or maybe there's an extra tooth or a missing tooth. These are all different things we're looking for if you're coming in for a consult, whether you're 7 or 8 years old, or you're 57 years years old. These different things are things that I'm looking for when I'm looking at every single consult. So basically, how to determine if you or your child needs braces. I'm going to go through all these different things when you come in for a consult. You can kind of do it yourself. You can kind of look in the mirror and see if you have too much spacing, too much crowding. Maybe that overjet's too big. Maybe the overbite is too big. Maybe you have a crossbite. Those are things that you can look for to know if you or your child needs braces. So once again, it's Dr. Nate here at Thrive Dental Orthodontics. And remember, I'm making videos every single week and I'm trying my best to answer your questions and comments. So please leave them below and please subscribe, and I will see you guys in the next video.